All right, let's talk about something that's often pushed aside as just a quality of life issue. We're going to reframe male sexual health for what it really is, a critical, flashing sign of a man's overall health. This isn't just about what happens in the bedroom, it's about what's happening in the heart. So let me ask you this. Could a problem in the bedroom actually predict a heart attack down the road? It sounds like a stretch, but it's a question that medical science is now answering with a pretty loud yes. We're going to unpack how sexual function can be one of the earliest warning systems for much bigger health problems. And this is why it's so important. According to a huge study from the Mayo Clinic, guys between 40 and 49 who have erectile dysfunction, they have a 50-fold, that's 50, higher chance of developing new coronary artery disease. 50 times. That's a number that should make everyone sit up and pay attention. So you see, this is not just some random coincidence. It is a direct signal. Erectile dysfunction and heart disease aren't really two separate issues. A lot of the time, they're just different symptoms of the very same underlying problem. Here's the best way to think about it. It's basically a plumbing problem. The arteries that supply blood to the penis are tiny compared to the ones that supply the heart. So guess which ones get clogged up and show signs of trouble first? The smaller ones, right? This can happen years, literally years, before you'd ever detect a problem in the heart. So ED becomes that first warning light flashing on the dashboard. To really get why this is such a powerful indicator, we kind of have to understand the mechanics. An erection isn't simple. It's this incredibly complex dance between your nerves and your blood vessels, and it all depends on a healthy, flexible circulatory system. The whole thing is about high-flow blood delivery. You can almost think of an erection as a natural stress test for your blood vessels. It forces them to relax, open up wide, and handle a huge surge of blood. If they can't do that job properly, it's a massive clue that there's trouble brewing somewhere in the system. And here's how that biological chain reaction actually works. First, you get stimulation, which releases something called nitric oxide. That nitric oxide then creates another molecule, cGMP. Now, cGMP is the real hero here. It's the messenger that tells the muscles and the arteries to just chill out and relax. That relaxation lets blood rush in, pressure builds, the veins get squeezed shut, and the blood gets trapped. If anything that chain is broken, especially good blood flow, the whole process just grinds to a halt. This is exactly why the medical world is taking this so seriously now. You see it right here in the clinical manuals. They stress that finding ED, especially in younger guys, isn't just about sex. It has prognostic importance. In plain English, that means it helps them predict the future risk for other conditions, like an enlarged prostate, and of course, the big one, cardiovascular disease. Now, it's also really important to know that male sexual dysfunction isn't just one thing. It's actually a pretty broad category of issues, and what's most common can change a lot depending on your age. Research basically shows us a tale of two different age groups. For younger men, say from 18 to 59, the number one complaint is actually premature ejaculation. It's only when you get to the older group, guys 57 and up, that erectile dysfunction really takes over as the main problem. And if we look at the numbers for that younger group, they really tell the story. Premature ejaculation is an issue for about 21% of guys under 60. But look at ED. While it's a super important health marker, it's only reported by about 5% of this group. It just goes to show you that the approach to treatment really has to be tailored to the person's age. Okay, so what can be done about these issues? Well, the good news is modern medicine has a whole toolbox of options. The best path forward is usually a shared decision between a patient and their doctor, and it almost always starts with the basics. And that first line of defense is always lifestyle. Take a look at this list. Does it look familiar? Losing weight, getting more exercise, quitting smoking, managing your blood pressure. These are the exact same things the doctor would tell you to do to prevent a heart attack. What's good for your heart is good for your sexual function. It's all connected. Of course, medications are a huge piece of the puzzle. The most common ones are called PDE5 inhibitors. Remember that key molecule we talked about, cGMP, the one that tells arteries to relax? Well, what these drugs do is they block the enzyme that cleans up cGMP. This lets cGMP stick around longer and do its job better. But one thing is absolutely key. You have to have sexual stimulation for them to work. They don't create arousal, they just help the body's natural response along. But here's the thing. Not all these pills are created equal. They each have their own personality, you could say. Some kick in really fast, but don't last as long, and you have to be careful about taking them with a fatty meal. Tadalafil, on the other hand, takes a bit longer to get going, but it lasts for a much, much longer time, which is why some people can even take it as a daily low-dose pill. And hey, it's not just about pills. For men who don't get the results they want from oral meds, there are a ton of other really effective options. The whole idea today is to find the right fix for the right person, whether that's localized treatments, special devices, or even, for some guys, incredibly effective surgical implants. But here's where the story takes a very modern turn. The whole landscape of how men are getting help for this stuff is going through a massive, massive change. And this change brings amazing convenience, but also some pretty serious new risks we have to talk about. What am I talking about? Direct-to-consumer online platforms. You've seen the ads. These are the websites where you can get an online consultation, get a prescription, and have ED medication shipped right to your door, all without ever stepping foot in a doctor's office. And their growth has been, well, insane. I mean, just look at these numbers. They're wild. In just 2 years, from the end of 2017 to the end of 2019, the number of people visiting these sites every quarter jumped from around 650,000 to over 11 million. That's a fundamental shift in how men are dealing with this. But this incredible convenience comes with a really serious trade-off. On the one hand, yeah, it's easy, it's private, it's accessible. But on the other hand, there's no physical exam, just a questionnaire. And here's the biggest risk. You might successfully treat the symptom, the ED, while completely, totally missing the underlying cause. You're silencing the canary in the coal mine without checking for the gas leak. And the medical community is pretty direct about this danger. As one clinical manual puts it, patients using these websites might think they're getting a real medical evaluation when they're not. They're getting a prescription, sure, but they could be missing a diagnosis that could literally save their life. So if you walk away with just one single thing today, let it be this. Your sexual health is not in a separate box from your overall health. It's a direct window into it. The goal should never, ever be to just mask a symptom. It has to be about digging in and finding the root cause. Which brings us to a final, really important question. When you think about it, given that it can help predict our risk for heart disease, for diabetes, for all these serious problems, isn't it finally time we drop the stigma, stop whispering about it, and start treating sexual health with the seriousness it deserves, as just simply health?